Kinesiology taping for anterior knee pain. So what is anterior knee pain? Well, it can be classified as many different things, and one big umbrella for pain in the anterior part of the knee is patellofemoral pain syndrome. And other diagnoses that you might find, or differential diagnoses, are conditions such as chondromalacia patella, which is a softening of the cartilage of the patella, patella tendinopathy, and also Osgood-Schlatter's, which we have discussed in another online learning. So for this online learning, we're going to be focusing on general pain around the area, which may be caused by a patella tendinopathy or other factors, which we'll discuss on the next slide. So some potential or possible causes of anterior knee pain are often to do with the joint itself or the muscles and tissues surrounding the joint. There may be some overload or overuse of the patellofemoral joint itself. Also some muscle weakness, imbalance, dysfunction, or perceived tightness of all of the muscles surrounding the knee joint itself. And they may include the quadriceps, the hamstrings, gastrocnemius, the iliotibial tract, and even to the long adductors as well. As with anything, it's really important to assess before you go into treatment to find out you're taping and treating the correct issue that your patient has presented with. For the purpose of the taping in this video, the client has been experiencing anterior pain around the patella area, and it's due to a general weakness within the quadriceps muscle group. When working with clients or patients with anterior knee pain, it's important to consider all different options based on what you found in your assessment or examination. You may want to consider overactive quadriceps, and you may need to inhibit those quadriceps and or increase range of movement and flexibility through the quadriceps tissue to increase range of motion at the joint. You may want to decrease that pain around the tendon and reduce any inflammation around that area if your client is presenting with acute pain. There may be weakness in one or more of the hamstrings creating that pain. So further into your treatment, you may want to consider some quadriceps strengthening. And also in looking at that range of motion, there may be perceived tightness in the tissues around the knee and also the hip. So muscles such as the hamstrings, the gastrocnemius, the hip rotators can all have an effect on what's happening in terms of the anterior knee. So as you can see, strength and range of motion is really important to help clients with patella pain or anterior knee pain. And it's important to integrate this into your treatment plan alongside the taping. So let's begin with the taping, looking at acute and early subacute phase of treatment with kinesiology tape. Here are the key points for kinesiology taping for anterior knee pain. To recap for this client, the client or patient has been experiencing anterior knee pain, but it's due to an issue of strengthening of the whole of the quadriceps muscle group. So our taping is going to be broad. So the two-step process to begin with is about inhibiting the quadriceps muscle group in total and also offloading the tendon towards the patella to help reduce that pain and sensitivity in the area. If there's any inflammation present, then you can use a lymphatic drainage taping around the knee joint and also pain desensitization taping where required. And if you have found any issues with the lateral knee, then review the lateral knee pain taping video also. So we begin with inhibition taping for the quadriceps. We make a long anchor of the tape, applying it on the tibial tuberosity and sticking it down on a relaxed knee. We then apply a stretch onto the tissue by bending the knee, and with light tension on the tape, we apply the tape along the midpoint to the centre of the quadriceps muscle group. We then straighten the knee to attach the anchor on relaxed tissue and then stick the tape down. And once you have finished the quadriceps inhibition, we can start offloading the tendon at the patella, and you can do this on its own also. So you break off the paper at the centre of the tape, and then you want a heavy resistance, a heavy tension on the tape. And you want your anchor to go in and upwards towards the patella. Stick the section down in the centre and then relax the knee to apply the anchors on both sides and then rub to stick the tape. Let's move on to the subacute and remodeling phase for anterior knee pain. So as I mentioned, this client has some weakness in the quadriceps muscle group overall. So this step is a one-step approach to activate the quadriceps and to be used alongside strengthening exercises. Other options that you might want to consider with taping are inhibition of the hamstrings and or the gastrocnemius, activation through the gluteals, and that could be due to some range of movement issues within the hamstrings or the gastrocnemius, creating that anterior pain. But then also you want to activate the glutes if there's a rotation issue that might be causing that knee pain. As with everything, assess everything before you work into treatment, and those options are based on what you find in your examination with your patient. For quadriceps activation taping, so you measure the length of the tape, you take off the backing of the tape to create the anchor, and the anchor is at the distal proportion of the quadriceps. Place it on relaxed tissue, so a straight leg. Take off the rest of the backing, create a stretch on the tissue by bending the knee. Light tension on the tape. Tape goes over the centre of the knee. Relax the leg to place the anchor, and then rub to stick down.